Welcome back. Glad you're still with us. This morning we have Mr. Eddie Olivarez, the Chief Administrator with the Hidalgo County Health Department. Thank you so much for coming on this morning.
Well, it's a tremendous pleasure to be here with you today.
Thank you so much. So, you know, we're talking a lot these days about back to school. Some students are already back in the classroom, some just getting ready to go back towards the end of August. So one thing that pops up, and a lot of parents will understand, is as soon as the kids go back, we start seeing those illnesses come back home. What can you tell us about that, Mr. Olivarez?
Well, you know, it's not only for the kids, it's for the teachers also.
Oh, man.
Every year at the beginning of school, flu, COVID, norovirus, all these illnesses that are common with school. Why does it happen? Because people have been on vacation, they've traveled all over the country, they've gotten back. Everyone's sharing the different cooties and different bugs. So that's what's going on with that.
Sharing is caring.
Yes,
and is this because
caring.
they're already carrying it and maybe they don't know about it, or is it just because they're in the proximity of each other a lot more?
They're just in the proximity, and kids a lot of times, you know, they don't cover their mouth when they sneeze, they don't wash their hands frequently. But how do we prevent this? Get your vaccines for flu, get your vaccines for COVID. They'll be out in September. Vaccine for flu and COVID. It's not required to get them, but it's recommended to get them. Also, make sure you teach your children, especially the small ones, like if they're in daycare or preschool, wash their hands with soap and water. Very, very important.
Well, we do see those school supply lists now include some of those Clorox wipes, some of the hand sanitizer. What else do teachers need to do to help themselves out in the classroom with all
I think
the
what
kiddos?
teachers need to do also consistently wash your hands. Be careful with that. Get a physical before school starts. Make sure you've gone to your doctor, got a full physical. Make sure you get your flu vaccine, your COVID vaccine. Make sure all those things are in place. I think the other thing that's important for parents to understand, once a child has a fever of 100 degrees or a little bit more, don't take them to school. Have them stay home, because unfortunately, that's when they're most infectious, and that's when you could spread other illnesses to other children and the staff.
Exactly, and I know it's a tough choice for parents. It's like, do I send my child to school or not? But the answer is probably yes. Do not send them if they're obviously in pain, because what's going to happen is that they're going to call you anyway to go pick up the child, right?
But you know, now they have telemedicine. A lot of the different insurances, a lot of different companies provide telemedicine. So you could probably get that prescription. If it's just una tosecita, a little bit of a flu, it's very common. Just go through telemedicine. It'll be quick and easy. You don't have to go wait in the lobby.
Yeah.
But if it's a little bit more severe, of course, always go to your doctor.
Mr. Olivarez, I know that there has been a lot of parents, and I know it's been around since I first became a parent, because I saw it within my friends as well. But a lot of parents don't want to vaccinate their kids for whatever reasons, right? So what would be the advice for them?
So to me, you know, as public health, it's important that we look at it. Vaccinations, there's a requirement for back to school. You have to have your diphtheria, your pertussis, your polio, all these different core vaccines are required for school. And even for college, there's some vaccines required for you to enter into college. So those vaccines are very effective. They've been proven, they're safe. I think there's been a lot of misinformation on the internet. People spend too much time on TikTok, too much time on the internet. And this has been a proven fact to help prevent illness and prevent major disease.
Correct. And the pain is minimal compared to the good it'll bring.
You know, and what's so sad, there's parts of the other part of the world that polio is very active. There is diphtheria in the Middle East. It's so sad because those people are begging for vaccine, and yet we have them here and we don't take advantage of them.
That's right. Take advantage. We have them. We want your kids to be healthy and every other kid to be healthy. The last thing you want as a parent is to send your kid healthy, and then because maybe someone else chose to send their sick child, now everybody gets sick, right?
You know, but one of the other things, there's economic incentive too. Think about how much the school district spends on substitute teachers, on all those things so their staff is out. How much time do you lose from work? There's an economic incentive for you to vaccinate your children, keep your kids healthy, keep yourself healthy, because that actually saves money in your pocketbook every year.
There you go. You heard it from the expert. He said go get vaccinated, so try to do your best to do just that.